What's going on, guys? Coach Jason here,
Coach Sharon.
Coach RJ.
and welcome back to the Mach 1 method. Today, we're going to be talking about a pretty interesting topic because I think a lot of the times it's thought of as the inverse, but we're going to talk about strategies we can use to lower body fat while either increasing our strength or at the very least maintaining our strength. Right. So a lot of the time when this topic is brought up, people typically think weight loss, weight gain, strength gain. That's can be true, but that doesn't have to, it's not the only case scenario where that's true. I think the places where that is the case is when either, weight change endeavor is done in an untimely manner. So extremely quick weight loss or, even steadily, but extremely quick weight gain. I don't know if he's extremely quick, but just like steady weight gain, you know, can help you gain strength, but like rapid weight loss and rapid changes in your body can lead to strength loss, right? And because when your body loses fat or just body weight quickly, you're not just going to lose fat, but you're going to lose muscle, right? So, healthy you, coach,
Yes.
right next to us. So why don't you kind of get into some recommended time frames to manage, weight gain or loss at an appropriate rate to not affect your strength and your performance?
Sure. So, especially, I feel like more cases people come into the gym, they're looking for weight loss, just generally speaking. And I get so many times like, oh, so I need to not lift, I need to do cardio, and I need to like cut calories dramatically. It's always like, no, that could not be further from the truth. Do not do that. You will feel like death. So generally speaking, I mean, now it's starting to pop up on the internet more, which is great. Like, okay, you need to strength train if you want fat loss. So I'm happy that that's becoming more and more of a thing out there. Because the more muscle mass you have on your body, the better your metabolism is. And the way to keep that muscle mass is through strength training. So that's one thing that we really want to keep. Now, in terms of, were you asking timeliness? I forgot your
I think
question.
it was like appropriate timelines. Like what's like someone comes in and they're like, I want to lose X amount of weight. Like
Sure.
what's like a reasonable timeline? I guess you could go like
I would say generally speaking,
drastic and like a shorter one.
I would say like a very slow gradual one. You could say like half a pound per week to start off, and then I wouldn't try to exceed like 2 pounds per week, generally speaking.
And I guess my question would be, is that someone, because you have some people who have like, bigger goals depending on the scenario. Do you find that for somebody losing, I don't know, making it up like 20 pounds or less, or like a 50-pound, or is that generally like across the board?
Generally across the board, but you could say that too. If people want to lose 50 pounds, I say, all right, that's our long-term goal. That's great. Slow and steady wins the race. What's our short-term goal? What are we looking to accomplish within the next month or 6 to 8 weeks, something like that? I think it's important to break it down so that way it's realistic. So you see all these commercials, it's like lose 30 pounds in 30 days. And they're like, no, I want that. And that's not going to be sustainable, and you're not going to be able to maintain that because the means just to get to that point are disgusting.
Right. I would say like maybe an outlier to that situation would be like someone who's like, let's say just my height, around 6 foot, and is like 400 pounds.
Yeah.
Like, that's a really extreme case scenario where it's like,
Yes.
yeah, we need to lose weight pretty rapidly because that's like a dire situation. But like, let's just say you're someone like exactly my height and weight, like 230, losing 50 pounds is definitely a long-term goal. Like I'm not going to go sub 200 in 2 months.
Sure.
Like that's just going to destroy metabolism, destroy performance, degrade all your muscle. Like that is not a good look.
No, absolutely not. So it's definitely important to I'd say one before we even get into the nutrition or the strength training. Prioritize patience. It's truly a marathon, not a sprint. Um, One thing or the common thing I should say that I hear from Healthy You feedback wise is everyone's like, wow, I feel like I can keep doing this, like even after the 8-week program's over. And that's what fat loss should be. It should be something that's maintainable for the long term. So, I mean, generally speaking, if you're looking to lose fat, you're going to have to cut calories somewhere. Now, how much of a cut you want to do, that depends on the person and honestly, what you're eating at prior to cutting. That also is a factor. If there's someone who's maybe under eating a little bit, we want to bring you up to baseline first and then cut you down. Because if we're cutting you and you're already, sub maximal calories, it's going to be horrific. So it depends on the person, and a good nutrition coach, takes all of that into account before putting you on some kind of diet plan for that.
I think like to relate it to the performance side of things, like in the scope of like strength training, like a good nutrition coach is also going to cycle that pattern, right? It's not just like, okay, we're starting a cut and we're keeping a cut going until we get to the end goal, because that's, not how the metabolism appropriately responds. You need to, like, we'll use 50 pounds as a weight loss, right? You maybe aim to lose 10 to 15 over the course of 10 to 12 weeks, and then hold, pause, let your metabolism catch up. Let's stay at this body weight, allow this like new body, quote unquote, to train at this level, get used to it, keep the metabolism revving, allow yourself to keep making strength training progress. And then after another, let's say 10-week cycle of maintenance, start another 10-week cycle of cutting, right? And it's like going one, stop, go, stop, go, stop. That kind of gradually gets you to the point where you need to be and will mitigate any sort of deterred performance as much as possible, and will help you retain as much muscle as possible.
I actually just had a conversation with a client this morning about this because, he expressed interest in cutting, and I said, that's great. That same roadmap that you just mentioned, I'm like, this is the general timeline for that. And he's like, wait, we stop for a little bit? I'm like, you have to stop for a little bit. Yeah. It's important to rebuild your metabolism back up. And, once it's all laid out, it makes perfect sense, but it's something that, again, does require a little bit more time. And, if you're willing, for the long game to put in that time and effort, definitely goes a long way. Yeah. Oh, yeah.
Mm-hmm. Kind of think about it like a visualization. It's almost like, building a road up a mountain, right? Like the road isn't built straight up, it's almost built along the side of the mountain. Sure. Right? And like sometimes there's a climb, and then there's like kind of like a straight path, and then there's another climb, and then a straight path. You can't just drive straight up the mountain. It takes too much energy, and you'll bottom out, for lack of better terms.
Sure.
Yeah, I think people don't realize. Like I know there was a period for one of the weightlifting comps I had to do a cut, and like it was pretty stressful. Not that I did it poorly. It was just a matter of like I didn't realize like you'd be a little more fatigued, you'd be tired, you'd be irritable. You'll have a little bit of that, and again, it took more time than I had anticipated. Like I was like, oh, like no big deal, a couple weeks.
It was a more aggressive cut, I'm guessing?
No, it was a longer, it wasn't like a huge thing. It was like half a weight class, so we're talking like 4 or 5 kilos. But,
sure.
I like my maintenance to be a little closer to where my like heavier weight class was. And at that point I was trying to qualify at the lower one to be a little more competitive. But just like the exercises, stress on the body, like taking away calories is also added stress to the system.
Exactly.
I think that's like such a huge consideration when it comes to this whole scope of the conversation of performance related fat loss. Is if you're looking to optimize and increase your performance, that's one type of stressor. If you're adding in weight loss, that's enough. Like you can't ignore the fact that weight loss or fat loss is a stressing type of endeavor.
It's a huge
So
stressor on the body.
yeah, so I think that's like a really great point to bring up, and it just further, you know, showcases the importance of managing that. It's like it becomes stress management
Yeah.
at that point.
That's
It's
all it
like,
says, yeah.
right? So it's like, at the peak of a strength block, also, that's another consideration with all this. Are you going to make that phase of the program the phase where, we talked about cut, stop, cut, stop? Are you going to make that the phase where you're cutting? Probably not. It wouldn't make sense. You
No.
should make that the phase of your maintenance when you're in like an easier part of your program during your ebbs and flows. Great time to add the cut in because the demands of your training become less. So that's another way that you could manage your results and to the best of your ability is by pairing your cuts and your maintenances with the peaks and valleys of your training program. And that's also going to optimize your strength gain and minimize your strength loss.
Yeah, I guess a question to follow up on all that is, does this like similar process with muscle gain? Like if we're talking weight loss and fat loss, like with muscle gain?
I would say so also.
Yeah, 100%. Like the inverse would definitely be true. Like if you're looking to put on more size, right? Like it would just be opposite. Like during like the hard parts of the training block, that's a great opportunity if you're willing to, if your goal is to put on more size. Like now let's go into a calorie surplus. Now let's give your body the extra fuel it needs to hit the demands of your training. That's just going to make
That's the fun one.
that's
The fun one.
right? That's just going to make your training even easier. Your strength is probably going to explode, but to that point, you don't want to just bulk endlessly either. So when
Yes.
your peaks in your training ends, maybe you slow down on the surplus, go into more of a maintenance phase, and let your body just like you readapt to a lower weight class or a lower body type. You want to allow your body to adjust to a larger body. Like I think
You
that's-
hit diminishing returns at both ends of the spectrum, or there's the possibility for that to happen. That's what I mean.
Yeah. So I think that's a great point. Is like it's just kind of the opposite. I think where again, just to recap that. You're cutting, don't pair your cut with the peaks in your program. But if you're bulking, it's a good idea too.
Yeah.
Yeah.
I'm just thinking about Bob, who's not here today. He's coaching the powerlifting meet, but he's like, I had this conversation with him a few weeks ago. He's like, I added more carbs to my training. He's like, I feel freaking phenomenal. And that coincided with a peak in training for him. So it was like the perfect timing. His workouts felt really good.
Yep.
The phone is ringing.
Do we get it?
I know.
It's definitely a robot.
It definitely
3:20 on
is.
Saturday, it's probably a robot.
It's
Yeah.
definitely a robot.
All right, we're gonna let it ring.
We're gonna keep talking.
We'll take a message.
We're not leaving. We're
You're
not leaving.
not answering. Unless you're giving us something for free. Oh no.
That totally just.
Where were we?
Yeah. I think we were kind of recapping it,
Recapping a little bit.
Pair bulking and cutting
Yeah, I know we
with
were
the
doing
phase
that.
of your training cycle. What was I going to say? One thing I did want to pivot to, because it's something, I've kind of gone through recently and it's a very relevant topic, is the GLP-1 angle of this.
Yeah.
So a lot of times, GLP-1s, they can cause rapid weight loss. And, oftentimes people say, they're like, oh, if you go on a GLP-1, you're only going to lose muscle mass. Not necessarily the case. It is going to inherently put people in a caloric deficit. It increases satiety, you're eating less. And as someone who has been on a GLP-1 myself, you definitely have to prioritize your strength training and not really trying to exceed your strength goals, I'd say, but just trying to maintain throughout the process. It's so, so important.
So would you kind of compare someone who's using a GLP-1, their experience, like we talked about the person who's cutting and pairing that with their performance related goals. and how that matches up with the training program. Would you say yes or no
Mhm.
that like when you're on a GLP, are you kind of, I don't know how to phrase this the right way, but like almost like fighting the results of the GLP-1 despite of the training phase? Does that make sense?
I
like
hear what you're
like
trying
like
to
you
say.
know, like we're saying like, oh, like when you're cutting, don't pair your cut with your peaks. I'm not saying to do the opposite just because you're on a GLP, but like, are you, despite being in a caloric deficit, are you continuing to train hard to mitigate the some of the negative side effects that
Sure.
come with it? Is
I
that
have a
true?
follow-up question
Yeah.
too, which kind of goes along with it.
Sure.
Like with the GLPs, are there phases? Like how does that work? Like is it phased in and out to
Well,
match?
and it all depends on your doctor, who's prescribing it, because there's so many gray areas with that. You could be microdosing or you could be on like the highest dosage of it. I would say it is a little bit different compared to like the bulking and cutting cycles that we just discussed before. I would say it's almost like you're trying to create a new maintenance for yourself. Because no one knows specifically how long a person's going to be on a GLP-1 for, so that's a factor, but it's just trying to maintain your strength levels, because it is such a drastic change for a lot of people. And a lot of people, some people, there's been studies where it's like, oh, they've lost 40% of their muscle mass, which is terrible. That's bad weight loss. We want good weight loss and stuff like that. So I would say that's where you really have to, I recommend journaling and like listening to your body's signals and stuff like that, because GLP-1s, they could bring you up, bring you down, keep you steady, space it out. There's so many angles, and not every doctor is necessarily the most knowledgeable with that. So I would say the takeaway, like if you're on a GLP-1, just try to maintain strength by, keeping your protein intake high. That's the most important macro. Strength train, I'd say 3 times a week. And don't be afraid of the carbohydrates. So, a little bit different angle on it.
For sure. I think that's really good insight for anyone who is currently or looking to take it.
Because they're so
Kind of a,
common right now.
yeah, and there's a great use case for them, but being mindful of what the negative side effects are and how to combat them, like you mentioned, is really important.
Absolutely.
Kind of a follow up to your point, like you asked about like phases of a GLP. To my understanding, most people, like you said, like you don't really know how long you're going to be on it for. It's kind of like TBD based on your doctor, based on where you're at and everything like that. But from what I've, whether it's talking to you or talking to other people, most people, it sounds like no one is cycling upwards in the GLPs, generally speaking. Like most people start at a certain dosage and then gradually taper off. Do you?
No, that's
No?
not the case. You start at the lowest dosage and you taper upwards as
Okay.
needed. But how
So it's
high
more of
you
a
go, it's a pyramid.
so it's more of a pyramid than a ladder.
Yes, it's like the plot diagram from
Yeah.
elementary
Yeah.
school.
Okay.
Yeah.
Gotcha.
So you build to the climax and then you slowly taper off.
Okay.
Yeah.
So I guess to that point, saying that out loud, since it is a pyramid and there's a point of climbing, when you're climbing in the dosages, that's when you're going to see the more rapid weight loss, I would assume, right? Like
Generally
as you're,
speaking, yes.
so that's when you want to, like you said, like prioritize your protein. But because you're going to be experiencing a lot of weight loss, not in a sense of downplaying your training, but maybe that's not the time to like go for like a high peaking training program,
I would not recommend
right?
it.
So maybe on the downside of that pyramid is when you do want to, like, if you can, time out peaks in your training program to be on that downward part of the pyramid rather than the upward part.
Exactly.
It sounds like.
Yeah. And one thing that even helped me when I was on it, deloading like once a month was tremendously helpful. I found just in terms of like recovery and then being able to like continue to strength train, at a level that I was comfortable with. Deloads are definitely helpful in that whole process. But again, it varies so much depending on the person. But it's definitely something that's more and more common, definitely on a needed basis for a lot of people. So,
Yeah, I think a couple good ideas in terms of we're talking fat loss, we're talking muscle gain. I guess just brush on the fact like what is the importance of like rather than that's not just the simple fact of building muscle, but like overall health and metabolic wise, like what does building muscle do for you? Like why is that something that people should aspire?
sure. Well,
If we can open that up, we can bounce back and forth.
yeah, it's the key to, I think, overall longevity, in my opinion. The more muscle mass you have, the better. And the more you maintain your muscle mass as you age, the healthier you're going to be. Old people, whatchamacallit, like fall risks and stuff like that, just being able to recover quicker. It's so incredibly important and so incredibly slept on.
Yeah, it definitely comes into like my angle with the physical therapy office. Like you see the individual could be like an older person, where you have some people come in and, as you get older, Mr. Dan calls it, I'm trying to get slower. So essentially, like the thought is, it's inevitable. We age, we lose function, but like it could be a quick or it could be a little slower in terms of, maintaining that function over time. And then two, like going into surgery, if you, have, better function and more muscle mass, like the outcomes are so much better, especially with something like an ACL that we treat pretty often.
Shout out Frank the Tank.
Yeah, Frank the Tank.
Yeah.
So that would be on my end in PT. Super important to maintain, muscle and your overall function.
Right. I think like to highlight what you said, how your opinion was that it is the key to longevity.
Yes.
And I think what makes it more than just an opinion is how parallel correlated muscle mass and bone density increasing are. And like, you mentioned like whatever fall risk or post-op recovery, like it's not just the muscle mass, it is the bone density. And, I think a lot of people think like gaining means like a lot of people I think are afraid to gain. But we're in a society that
I don't want to touch the weights because I don't want to look like Arnold.
Oh my God.
Well, it's that, but I think we're also in a society that like, it demonizes, obviously like being unhealthily fat. But gaining doesn't necessarily mean gaining fat, obviously. Like we need to put ourselves in a surplus at times to optimally gain muscle. Like I think of maybe an older population person who doesn't have any experience with strength training, comes in, they are like maybe how we would describe them, like skinny fat, where they're not like inherently like super overweight, not underweight, but they're like between 30 and 40% body fat. And it's not because they're so fat, but it's just because they don't have a lot of muscle mass. It's like, all right, we need to kind of increase your calories because we need you to start strength training and fuel for the performance needed to decrease that body fat percentage. And I think that's kind of like a whole other angle to like look at this from, a whole other scope of like the context of gaining, is not something to just totally be afraid of. Right? Like it's not just we live in a very weight loss oriented society, but there are certainly appropriate times to prioritize a surplus and a gain.
Yeah, I think now there is a big push to like build muscle and maintain function, in the exercise and physical therapy space. Like podcast I just listened to was with, KDD. She's a unit down in Miami, but she was essentially talking about how, there are like fat deposits in contractile tissue, right? Where there should be a spot that should be a muscle that works like to help build power and strength, but there's some adipose in that spot. So, that's something that we can use and adapt through exercise and resistance training.
For sure.
Yeah. One thing I definitely, when I sit down with people, I find most people want body recomposition more than anything else, but they don't know what that term is. And, they just look at it from, it sounds fancy, but it's really not. And For those of you who don't know, it's just basically you're building muscle, but you're simultaneously decreasing the fat stores in your body at the same time. And, I tell people, I'm like, that's not going to make you look bulky by gaining muscle and burning fat. If anything, that's going to get you more of that aesthetically pleasing look that 90% of people come into the gym for. So
I could add on to that. I think, like, just to also clarify, sometimes simultaneously can mean the exact same time.
yes,
But I think simultaneously can also refer to a spaced out period of time, just to taper expectations. We talked about going up and down and up and down and maintenance. Like sometimes simultaneously, even though it's not exactly what it means, but it means maybe in the scope of like within a year, we're gonna cut some body fat, gain some muscle, level off, and like you might finish a year later at the same body weight that you started with, but maybe 5% body fat or 10% body fat lower. And that's what a recomp can mean also.
It can, yeah. Usually when it's like simultaneous, that's more for people who are newer to working out. It happens very quickly. If you're a more seasoned member, then it's more the cycles of bulking, cutting, maintenance, all that good stuff.
Yeah.
But,
Cool.
yeah.
Went over a ton there.
We talked about a lot.
Yeah.
I'm hungry. I don't know if anyone heard my stomach growling on the mic before. You might hear that later.
Well, on that note, then.
Yeah.
Sharon, hangry.
No, I'm not hangry. I'm just hungry.
Okay. All right. Well, but before it gets to hangry, and then who's going to have to hear about it? Let us know in the comments what was your favorite part about today's episode. I feel like we touched on a lot of really cool stuff. So let us know in the comments what your thoughts are, and we will catch you in the next episode.
Boom.
Mach 1 out.
Boom.
Boom.